dallasrenalgroup.com or on the Dallas Renal Group Facebook page. This is Dr. Samir Nangia, and I'm co-hosting today's show with Dr. Paul Cespedes. We are live in studios with Dr. Neha Singh discussing podiatry, and the number to the studio is 972-235-5555 to be part of the conversation. We had an exciting first half of our show. In fact, all our lines are full, so we are going to try to get to everyone, but if we don't today, remember we have a website, doctalklive.com. Please submit your question there, and Dr. Singh will get back to you with your answers. Before we jump into some of the questions from the break, we had talked about fungal infections and how can they be treated in the foot.
Okay, so fungal infections, that can be of your nails or of your skin. There are a variety of topical medications. Some you can find over the counter, don't really have very good evidence for treating fungus. So your best bet would be to either get a prescription topical, or the best evidence is for an oral medication called terbinafine. And if you see your podiatrist, we can definitely get you started on that treatment. It's very effective. And
Great. Dr. Singh, during the break we had somebody call in, their dad, he's in his 80s, has diabetic foot pain, nerve pain, which is pretty common. And they've tried over-the-counter creams and lotions, doesn't really seem to be helping. It's kind of, it's causing problems. He can't get around as easily as he'd like to. What kind of options are there for diabetic nerve pain? And maybe more broadly, what other complications do you see with diabetes in the feet?
So it's a great question. I would say over half of our patients that we see are diabetic, and when it comes to neuropathy, that is the number one complication from diabetes that we see manifested in the lower extremities. So if they've already tried lotions and creams, things like that, the most common medication that we prescribe for treating the pain and the burning sensation associated with neuropathy is called gabapentin. It is a prescription that you would have to get from your doctor. In terms of diabetes and other complications, if you have neuropathy and you also smoke, for example, you could have poor circulation. These things lead to foot ulcers or wounds in your feet, and if you don't have good sensation, it can lead to an infection and possibly even amputation. And so those are the things that we try to prevent when we see diabetics in our practice. Actually, the American Diabetes Association recommends that every single diabetic needs to see a foot doctor once a year, just like they see an eye doctor annually. If you're already having any symptoms of neuropathy, which it's nerve damage from having too much sugar in your blood. If you're already having symptoms, which would be burning, tingling, or even numbness, you need to be seeing a podiatrist every few months.
And speaking of the diabetics who are listening or have family members who are diabetic, they're supposed to see a foot doctor every year. So if they want to come see you, for example, how would they do that?
So my practice again is located in Allen, inside of the Presbyterian Hospital of Allen, and you can visit our website at www.allenfootdoctor.com.
Great. So for those who are just tuning in, we're live in studios with Dr. Neha Singh. The number to the studio is 972-235-5555. We'll take your callers here over the next 10 minutes. Let's take our next caller.
Hi, thanks for calling Doc Talk. Go ahead with your question. Hello?
Can I start talking?
Yeah, go ahead.
Yeah. Hello, Dr. Singh. Thank you for taking my call. I have a couple of separate questions, one related to my husband and the other one is to me. And the first one is that my husband's been suffering from his spur, so to say, and the doctor prescribed him meloxicam 15 milligrams, and it has helped him to some extent, but would you recommend a steroid shot or something more drastic as a surgery? And the second question is related to me. I do feel occasional numbness in my left toe, which is I guess related to the level of sugar in my blood, or the level of hyperglycemia. My question is that why it affects the left toe more than the other one, and how wary one needs to be of the symptoms, and why is it that it affects the foot in terms of neuropathy the most? Thank you so much.
Some great questions for you right there, Dr. Singh. You want to start tackling them?
Sure. Okay, so for your husband, you mentioned heel spurs, so that sounds like plantar fasciitis, which is a very, very common thing that we see. So if he's already taking meloxicam, which is a great medication as an anti-inflammatory, if he is still having pain in his heel, especially when he first gets up out of bed, and is not able to do his regular activities, a steroid shot in the heel is definitely the next step. So that would be something to consider. I wouldn't jump to surgery yet. Usually about 90% of patients with plantar fasciitis get better without having to have surgery. So definitely go for the steroid shot, but keep in mind you need to also not be walking barefoot, not wear any flat shoes, wear arch supports in your shoes, or orthotics as we call them. Do some stretching exercises, and you can ice the heel as well.
And about the neuropathy?
Yes, so diabetic neuropathy, as I was talking about earlier, it affects your lower extremity, which is your legs, ankles, and feet, because those are your peripheral nerves. Whenever you have too much sugar or hyperglycemia, as you mentioned, the way the nerves intake glucose, it makes the nerves swell and just causes damage to the nerves. And so you lose sensation, you lose feeling, and it can cause numbness. So that's why that's happening to you. And like I said, there is medications available, but the number one thing you can do is control your blood sugar. That will prevent it from getting worse, and that's really the best thing you can do.
Thank you. You're listening to Doc Talk Live. We're in studios with Dr. Neha Singh, and we're discussing foot problems. So if you have a question, the number to studio is 972-235-5555. Let's take our next caller here.
Hi, thanks for calling Doc Talk. Go ahead with your question, please.
Hi, thank you for taking my call. Sometimes, moreover, during the sleep time or midnight, I feel either one of the leg, I feel the cramps. And I need to get down on the bed immediately, and until it settles down, I cannot sleep. Is it normal or something I need to worry about? Not very often, like let's say 2 weeks once, either one leg, little later another leg kind of thing.
Okay, great question. So having cramps in your legs at night is definitely something I would say to be a little concerned about. There are many different reasons why that could be happening. It could be nutritional deficiencies, it could be that you have a circulation problem, and so definitely a reason to see your doctor, because I wouldn't say it's necessarily normal, and if it's affecting you in your sleep, then definitely get it checked out.
Great, let's take another caller.
Hi, thanks for calling Doc Talk. Go ahead with your question, please.
My question is, I get a lot of cramps in my legs, especially the toes, and it's very painful, and I don't know how to relieve them. Whatever you do, you try to increase, and it is more frequent in the night. And I also see that my two kids, who's 13 and 6, they're also having similar issues. They say, they have cramps in their toes. So I want to know what I should be taking. Do I need any multivitamin or any other consideration?
All right, so cramping in the toes is, like I said earlier, it could be a variety of things that could cause that. You would probably need a physical examination to determine what's going on. If you and your kids are having it, it could be a result of having a certain foot structure. So, for example, flat feet can cause a lot of different problems like cramps in the foot or in the arch because your muscles and your tendons are just not able to do what they're supposed to. So definitely a good reason to go to your doctor and get checked out.
Let's take a few more callers here.
Hi, thanks for calling Doc Talk. Go ahead with your question, please.
Hi, doctor. I have a problem that I have my both knees are arthritis, and today I just got a shot with my primary doctor. They give two shots in 2 knees, and it is a temporary pain relief. But I just wanted to know something to eat for arthritis, but my doctor not recommended. Can I ask you some kind of patent medicine from the counter? Can I buy it from for arthritis?
Okay, well, I'm sorry to hear you have arthritis in your knees. From a podiatry perspective, I would say that one thing you can do is add orthotics or arch supports in your shoes. They can actually help stabilize the joints, not only of your feet and your ankles, but of your knees, hips, and even your back. And that is one thing you can do to help with that.
Hi, thanks for calling Doc Talk. Go ahead with your question, please.
So at night time, not every night, like once in a while, I get my thigh muscle kind of the spot where it gets very hard and it pains severely.
Okay, I think he said thigh muscle. So again, that is part of the lower extremity cramping, like we've mentioned before. So it could be, and we do hear frequently that it happens at night, so it could be a variety of things again. Drinking enough water, making sure you're getting the right types of electrolytes, and sometimes stretching is a big thing. If you have tight muscles in your calf or in your thigh, that can cause cramps. So definitely get on a stretching regimen and be evaluated by your doctor to make sure that it's nothing more serious.
I just want to thank everyone who's been calling in with these great questions, and I apologize if we can't get to everyone today. But I do want to get a few questions in. Maybe Dr. Singh, you can talk a little bit about why people will get shin splints when they run, for those who are very active.
Sure. So shin splints, the root cause is having tight calf muscles, which is good. I just mentioned that. The way our feet compensate for having a tight calf muscle is to pronate, and what that means is, if you can imagine your foot kind of collapsing down in the arch. And so when we pronate, that puts increased stress on the front of our shin. So this is going to be most common in someone with a flat foot. So to prevent shin splints, before you run, you want to do some aggressive stretching exercises for your calf muscles. And you actually need to be stretching every day. That's really important. And wear supportive shoes when you run, and sometimes orthotics or inserts in your shoes as well.
Great, and we got 30 seconds left. Quickly, Dr. Singh, again, how can we all get a hold of you?
Great, thank you. Again, I practice in Allen at the Allen Presbyterian Hospital. We are the Allen Foot Doctors. I work with Dr. Victor Schechter. And again, my name is Dr. Neha Singh, and you can visit our website at www.allenfootdoctor.com.
Thanks everybody for listening. Don't forget to check us out on Facebook, also on YouTube, doctalklive.com. This is Dr. Paul Cespedes and Dr. Samir Nangia signing off. Stay healthy, DFW.